Assalamualaikum warahmatullahi wabarakatuh. A very good afternoon to everybody listening. I'm Dr. Khaldon Ismail from University Kebangsaan Malaysia in Kuala Lumpur. I'll be presenting on the topic on RECS, or Remote Envenomation Consultancy Services, clinical toxinology module, and collaborations that we have done in Malaysia. Science for the masses. So first of all, I would like to say thank you to the organizing committee for inviting me today, and I hope everybody is keeping safe. This is the agenda of my talk. First, I will go into a little bit of definition regarding clinical toxinology and what we have done over the years. And this includes sharing some research output, and we'll take a look at some of the ideas that we should bring forward to the future. So just a little bit of introduction. Malaysia is in the tropical country. We are divided into Peninsular Malaysia and the other two states in Borneo Island. So being in the tropics, we are very rich in terms of fauna and flora, including those which can cause danger to humans. And they are dangerous to humans in terms of either causing physical harm, or they can cause injury through toxins, poisons, and venom. So in Malaysia, for a long time, we had some issues of knowing what is toxins, what is poison, and what is venom. So we sometimes use these terms interchangeably, which may or may not be appropriate for the particular animal. So we took an initiative some time ago where we engaged with the Ministry of Tourism and Culture and also the Department of Museums in Malaysia to educate the public regarding what is poison and what is venom. Okay, so basically a poison is if you eat, or if you inhale, or if it absorbs through your skin, it can cause harm to you. This poison can be either from chemical substances or from the natural substances. And venom itself is if these toxic substances is injected into you from these naturally occurring toxins, then it can actually cause harm to you. So that's what toxin is. That's the difference between poison and toxins. So some animal that has these toxins are called venomous, and some animal that doesn't have this toxin is called non-venomous animal. However, if the animal is eaten by you and you get the effects of the toxins, then it is called a poisonous animal. Okay, so the effect on human is actually a separate component to the status of whether an animal is venomous or non-venomous or poisonous. Okay, so the effect on human, we can actually divide it into whether there is a direct effect or is an indirect effect. And we classify the hazards or the significance or the severity of the effects of these substances into several categories. First is harmless, meaning that the substance that is injected into you it doesn't cause much of any issue. And those substances which is injected that can cause some pain or minimal injury, minimal swelling, for example, this is considered potentially not dangerous. It doesn't cause a permanent injury to you or morbidity. And those which can cause morbidity and mortality. So they are potentially dangerous and also potentially deadly. Okay, so this brings about the study on what we call the clinical toxinology, meaning that we look at the effects of the toxins or the chemicals on humans. And majority of them will actually present with some pain. okay, but not all actually causes pain, okay, especially those which are very specific to, for example, a neurotoxicity, okay, they don't really cause much of inflammation, therefore doesn't cause much pain. But after a while, you may have signs and symptoms of, for example, muscle paralysis, okay. So in Malaysia, the study of toxins started quite early, even before the establishment of emergency medicine in Malaysia. So at that time, in 1992, some group of researchers or scientists form what we call Malaysian Society on Toxinology, in order for them to conduct Asia Pacific Congress on animal, plant, and microbial toxin in 1993. So MST is the sole body in Malaysia, which is an NGO, non-governmental organization, which dedicate its purpose to toxin research. And from 2013 onwards, we add on the involvement of clinicians as well, which is the clinical toxinology component to it. So currently, Malaysian Society of Toxinology is actually well established in Malaysia. And we involve both scientists, which that lab research, and also clinical research as well. So the objective of the society is basically to improve the understanding and encourages progress in terms of uh, uh, setting up the networking between experts in the field of toxinology and becoming a credible reference point. So this is important for the country because at that time, as I mentioned earlier, not many people know about what is toxins, what is venom, and what are actually the animals that or plants or organisms that contains them and how it affects human. Okay, so because of our activity over the past years, we involve a lot of people, not just a lot of specialists or doctors and scientists, not just in Malaysia, but also in the ASEAN region. And this effort through the what we call ASEAN Marine Animals and Snake Envenomation Poisoning Management, which is a international symposium which we conduct almost every year before the pandemic, has stirred interest with some of the others in the region as well, and therefore come together and form their own society on toxinology. For example, in Indonesia, established the Toxinology Society of Indonesia in 2018, and recently the Philippine Toxinology Society in 2021. So the backbone towards the clinical toxinology is actually by what we call remote envenomation consultancy services. These are actually a group of specialists, as most of us are actually emergency physicians, working to minimize risk in terms of management to patient. Okay, so in 2010, it was first established by one person, but by 2012, we already expanded to involve more specialists, and this service is providing what we call a on-call consultation remotely, meaning that we don't have to be in that hospital to be able to help the doctors in that hospital. So all they need to do is just contact the remote environmental consultancy services consultants, and we communicate through online app or mobile app, and we follow through the patients during the management, and we actually provide the advice to support the healthcare system. Okay, so this is very important move because what we did was we minimized the error and complications in patient's care, and at the same time we enhance a favorable outcome of the management of patients. So we have seen a lot of improvement over the years, and RECS or RECS ASEAN now is actually working towards patients advocate. Okay, and at the same time also physicians advocate minimizing the risk of getting sued, for example. Okay. Yeah, and this is how it started in Malaysia. Basically, we started in 2010 with one consultant. By 2022, we already have 13 consultants, and all of them are emergency physicians. So this, I have to stress that currently we are run by emergency medicine. RECS Malaysia is run by emergency physicians, but we are open to any other specialists that are interested in clinical toxinology to join us to become the RESC consultants. So we also not just providing clinical what we call consultations, we also provide a lot of courses, and this involves both the public, for example, FACS, first aid course for snake bites, and also in the intermediate and advanced level, which is SAM, snake envenomation consultancy, snake envenomation management course, and also MSAM, as I had mentioned earlier. So over the years, the number of consultation has steadily increasing, partly because people are, the doctors and the hospital are more aware about the existence of RECS, and therefore we receive more and more consultations. So at the same time, the number is increasing. We are also building our capacity, training more consultants, RECS consultants, to able to provide the appropriate advice to those who consults. So most of the time, the consultations are due to for snake bite envenomation or snake bite cases, or what we call snake-related injuries. Okay, the majority of cases, more than 80% sometimes. So over the past few years as well, quite recently, we have become a bit more regional in ASEAN, and we form RECS ASEAN group. There's no more RECS Malaysia, RECS Indonesia, or RECS Philippines. We form what we call RECS ASEAN, and we work together in the region to achieve the same objective. And at the same time, we're thinking of having the platform for the development of ASEAN Fellowship of Clinical Toxinology, or FCT. So this is an interesting development regarding the collaboration that we form in the region. So in the RECS in ASEAN has now involved also Philippines, Indonesia, and also some other countries such as Vietnam, Laos, Thailand, Myanmar, and also in Singapore as well. So we are actually having some experts in this region so that we can actually provide the appropriate what you call reference point for those who wish to know more about clinical toxinology. So in Malaysia, quite recently, also in 2017, we also established connection, or what we call establish our networking with what we call Malaysian Biodiversity Information System. So this is actually a very interesting development, because we can actually document all the cases that we are conducting or consulted to, and we can actually then progress into what we call research approach to our work, and provide the appropriate data or appropriate evidence of what we do regarding clinical toxinology. So through this collaboration, we form what we call a MyBiz Toxinology module, and this is the database that we keep all our consultations data, and so that we can analyze them later. We provide the up-to-date information, especially for clinicians, regarding the species of medical significance in Malaysia that may or may not cause envenomation, but particularly about snakes. Okay, so we also provide the resource experts in the field. For MyBiz themselves, they are non-clinicians, so we provide an input about clinical management, and therefore we provide also the review of any publication that they made, so that the points or the facts that they put forward to the public is being checked and being verified. Okay, so it's very, very important that information that goes out to the public is actually verified and also updated. So we are working very closely in minimizing error or minimizing false information to the public by doing this collaboration. And the biggest component, I think, or success that we have seen through this collaboration is actually in terms of research and publications. So one of the the earliest publication that we did together was providing or making what we call the image gallery for land snakes of medical significance in Malaysia. And this has, over the years, developed to become a bit more tech-savvy, technically advanced, where we can actually you can actually access the online companion web app depending on where you are in Malaysia, and by clicking that, it can give you the list of dangerous or snakes of medical significance in that state. So this is very important because we have to understand not all the snake species are actually present throughout the whole country. So certain states have certain number or type of species of dangerous snakes, but you may not have other species as well. Okay, so this may have direct effect in terms of how the state can actually stock the appropriate antivenom for their state or for their hospitals. So we minimize risk, we minimize what you call wastage of stocking of antivenoms in each hospitals. So this is, for example, other research output that we have done together. One of it is what we call a cross-sectional study on pre-hospital care intervention for snake-related injuries, or SRI, consulted to RECS. So what we did is actually to look at what is the current situation in the public in terms of how they manage snake bite injury. So this is important because it will give us an idea of how we want to conduct what we call projects or courses or teaching materials for the public. Okay, so awareness programs. So we found that actually the public still in Malaysia still use a lot of inappropriate first aid, and most of them are actually using what we call tourniquet, and this is actually inappropriate. Others, for example, they will suck the wound, cut the wound, massage the affected area, and all this actually can cause more harm to the patient. So we also noted that besides the things that they do to themselves, they also did something to the animal itself, to the snake that bite them. So besides killing the snake, they also do a lot of other things that we found in the practice in Malaysia, which is some of them, they cut the head open and take the brain out and rub over the wound, thinking that it will actually absorb or neutralize the venom. So those are things still which is present in Malaysia. So it's a bit surprising, yeah. So these are the things that we can actually use to increase the awareness of the public, saying that, all these practices doesn't really work. So another study that we did was actually to look at whether the people who come to the hospital for snake bite will continue on what we call following the treatment that is provided in the hospital and not going to, for example, alternative medicine, which may or may not be effective for them or may even cause more harm to them. So we found that there are certain amount, the number is not many, but there are some people who still go to the traditional healers to seek treatment after they were already treated in the hospital. Okay, so that is a very interesting finding, and we find that most of the time the reason why they do that is because they still believe in the traditional healers. So this is added to our knowledge about how we can minimize the what you call or to increase the awareness in the public and increase the knowledge to the public, to not to go to the traditional healers and without first being treated in the hospital. So on top of that, we feel that the approach is to educate the public more on what we call the appropriate safety-seeking behavior and the appropriate health-seeking behavior. Meaning, appropriate safety-seeking is basically you try to prevent from getting the injury in the first place. So this includes, providing them information about what to wear, where to go, how to stay safe whenever they go outdoors, for example, or when they go working in the plantation and so on, to wear protective clothes. So we believe that the most important component for this area is actually prevention. So we need to inculcate what we call the safety culture in our society, so that the injury doesn't occur. So prevention is better than cure. But some people will still get injured, right? So this is what we call the appropriate safety-seeking behavior. The second part of our study just now is to make sure that they attend to the appropriate medical services in order for them to get the appropriate treatment to minimize or to optimize the outcome of the treatment injury for the injury. So this is a bit more, I think, expensive, because we may need to have what we call the system of the health system to be in the optimal situation for this to be successful. So depends on where you are in your country. You can look at both components. One is about the public education on safety, and also how you can improve the standard of service, health service in your country. Okay, both are very important. On top of that, we also did a few other studies being some of them are still ongoing. So these are just the list of titles of research that we are conducting from this collaboration with MyBeast Toxinology module. As I said just now, we provide expert service for the MyBeast Toxinology, or by actually reviewing the publications that they do over a period of time, so that make sure that all the information they publish are correct or are verified and are appropriate. So we have identified this, and we corrected quite a few, and they are very thankful for this type of collaboration with us. Okay, so medical field doesn't have to be just work in medicine. So we work also in, for example, conservation efforts. So we should not be too rigid in how we define where we work. We have to be a bit more open-minded in terms of providing our expert to help in general the whole safety-seeking culture in Malaysia, for example. Yeah. So I'm also involved with the WHO regarding the snake bite effort. To minimize snake bite, we are targeting to halve the injury numbers and also mortality numbers by 2030. So if you need to have a kind of a data, the basic data, to see how serious is a snake bite injury in your country. So in Malaysia, luckily we have not so serious issue, but we always try to provide the best treatment outcome if somebody got bitten by a snake, and that includes, for example, engaging with the community, as I have mentioned earlier, the ASSB, looking at our health system, the health system in Malaysia. Alhamdulillah, thank God, we are not too bad. We have rather effective and also good service for the public. On top of that, we also provide. Malaysia doesn't manufacture antivenoms, but the health system make sure that we have sufficient amount of antivenom and the appropriate antivenom for the country. On top of that, we also look at the outcome of patients' treatment. We see that through this RECS consultation, we have patients which with minimal morbidity, and so far very, very low mortality. Okay, and on top of that, we are also engaging with everybody in the region, the experts throughout the world. So we are basically getting not just local help, but we also getting input from around the world in order for us to improve the service to our patients. So as I had mentioned earlier, prevention is very important. For that, we need to empower the community with verified information and also knowledge. So not just for the community, but also for the healthcare providers. So in Malaysia, we have also the guidelines for clinical guidelines for the doctors, and these are standardized. So everybody in Malaysia gets the right and the appropriate information on how to manage snake bite. Okay, so that is very important because in Malaysia there are many doctors coming back from all over the world, and they may learn something which is irrelevant or not appropriate for Malaysia in terms of, for example, the species of snakes and the type of antivenom. So by having a standardized guideline like this and endorsed by the Ministry of Health, this will actually minimize the what we call gap between the knowledge among doctors. Okay. On top of that, the collaboration has to be open with all those who are interested in the subject. In terms of clinical toxinology, we have also, as you have seen, we involve the MyBis, and also we are closely working with the National Poison Center, or PRN, Pusat Racun Negara. We are also involved with all the societies, toxinology societies in ASEAN, all the RECS consultants in ASEAN, and these efforts were through the initiative of MSAM. And recently, just March 2022, we finally managed to get the recognition to set up our clinical toxinology special interest group in the College of Emergency Physicians in Malaysia. So finally, what I want to say here, we should not just be working in the hospital, but we have to go and to go out to the public, to the general population, in order by providing the appropriate, what we call, information for them, myth busting. So as I said just now, we still see a lot of errors or practices in the public which are is not correct. So how do we approach them in order to correct this? So for us, we've involved the public themselves, public groups, for example, run by the public themselves, groups of people who are actually involved in social media, and also providing them the alternative from just playing with snakes to actually using snakes for education during our courses. And we also promote the Snake Bite Awareness Day. This is actually by the WHO, and this is happening every year on September 19. Okay, so with that, I thank you. We are open for any questions.